All right, so it's the extra bonus talk, which hasn't been vetted, okay? But I would like to share this with you, so I'm just going to move these off. So there's an area of medicine that I'm particularly passionate about, and that's health provider well-being and mental health. And I think it's really relevant now more than ever, actually, when we hear in the press lots of stories about doctor suicides, about the burden of mental health now on people that are on the front line offering care to patients. And I think it's still quite a stigmatizing topic. I think people are reluctant to address it or talk about it. It still feels uncomfortable to raise. So I'd like to do like a short comedy sketch on doctor suicide, okay? In essence, all right? I'm just teasing. But the other caveat to this talk is, so I gave this talk to doctors and junior doctors before, but when I realized I was going to be presenting to a room full of practice managers, I was even more excited to deliver it to you. Don't throw it at me, for two reasons. One is because I actually think that as relatively solo, isolated practitioners, you experience many of the same problems that GPs face. So lots of this information is relevant to you, and I would like for you to stay well, and so maybe there's some tips for you to glean from this. But the other thing is you're in a really privileged, unusual situation where you actually see a lot of these doctors at work. You see the referral rates, you see how they're interacting with patients, you see. So I think if there is a problem, you're often one of the first people to raise it or to be able to intervene in a meaningful way. And that's a lovely position to be in. So I'm really hoping by the end of it, you might have gleaned a few things that you might adopt into your practice, all right? So it's called 10 Tips How to Survive Being a Practice Manager. You obviously already know how to do this because you're still here now, but you're never too old to learn. And it's actually 12 tips for everyone that likes, 10 tips. So this was the background I mentioned. Unfortunately, doctor suicide. So it used to be, which profession had the highest rate of suicide? Dentists, yeah. So it used to be dentists, but doctors by their very nature are very competitive people. So we have overtaken dentists now, and doctors have the highest occupational suicide rate. And I would just like to say at this point, it's a slightly frank talk. I'm not representing any health board or authority or practice index. This bit of the talk is just me, okay? So I know it's post-biscuit time, but will you just shout out why you think there might be an issue with healthcare provider and particularly doctor mental health problems at the moment, increasing suicide rates? What do you think it is about the nature of the work or those people that would cause this problem? Pressure, yeah, I agree. So work pressures. Anything else? Yeah, so work, the actual nature of work is changing, isn't it? And there's much more paperwork, there's much more, so what else do you think? Pardon? Oh, what did she say? Fear of failure, I 100% agree with you. It's a certain type of person that usually becomes a doctor, and they usually have kind of perfectionist tendencies, don't they? And they don't like to get things wrong. So I agree with all of those. So you have a cohort of people with perfectionist tendencies. They're highly externally referenced, so they usually are very receptive to praise, deal very badly with criticism. So when things go wrong, like you said, if they make a mistake, it's usually serious. High pressure job, high emotional intensity. Most people would be happy to complain if something goes wrong. Most people don't commend or applaud when something goes right. So I liked the pat on the back and the thank you for today. Isolation, again, especially for people working in the community, they sometimes don't see their colleagues, they just practice in their room alone. And then I put different times here. So you'll often see older doctors speak about how younger doctors have it easy. But I think with the way now that healthcare information is so readily available, patients are so much more informed, there's a much more consumerist model of healthcare, I don't think you can say that just because an older doctor may have had a longer physical shift, that it is less arduous now than a current doctor's shorter shift in hours. And then what I alluded to at the beginning, there is still a huge stigma around seeking help. People's immediate gut reaction is if they tell anyone they're struggling that they're going to be deemed unfit to work. And I think if you're really aware of that as a practice manager, you already are empowered. So all of those are a recipe for potentially being miserable. All right? So my first tip to tell somebody, if they're struggling with being a GP, is don't do GP full-time. Okay? Just raise your hand if you would recommend, if you had a child who has just left medical school, you would say, I think you should be a 10-session-a-week GP. If you had a GP saying, I'm wondering whether 10 sessions would be a good idea, would you say, yes, I think that's a good idea? Everyone is saying no, isn't it? So it sounds like common sense, but that is one thing. And actually, this is why I have a picture of me in my comedy poster, because you find an outlet, don't you, that helps you balances out your work. So there's loads of ideas, and you can talk through this. When you have a registrar and you think they're on that trajectory where you think, this isn't going right, say, have you thought about doing a day in palliative care, a day doing peds gypsy clinic? So it's just another way to think about it. So that's one easy tip. And this is the hard one for everyone, and a lot of practice managers included, okay? Accept imperfection. There's a difference between offering excellent care and offering perfect care. Perfect isn't really achievable, is it, guys? Excellent, actually, we can manage or we can strive towards, but perfect, you're setting yourself up for an impossibility. And like my original picture with practice managers being a master of all trades, it's a bit the same with GPs, and I think sometimes people lose sight of that. If you did have a doctor who's struggling with this sense, especially earlier on, I think people grow into it better, you can say, just remind them gently, look, you don't actually have to know everything about everything. That's why we have referral, we have consultation, and if you're unsure about your baseline knowledge, there's loads of ways that you can remedy that, like journals, online learning, update courses. And then I just threw in something to lighten the mood a bit. Yes, I've had my mammogram today. Why do you ask? And this one, again, it sounds kind of topical, but you'll see where I'm coming from. Don't expect anything from your patients. So who here has ever gone out of their way to chase a test result for a patient and then the patient hasn't come to collect it? Or, yeah, exactly, or they've really been upset that they've missed a hospital appointment, they've been discharged, but you've managed to get them seen again, you've managed to book another appointment, and then they don't turn up to that appointment. Did you take it a little bit personally when that happened? Did you feel a slight, tiny, died inside moment? Why do we do that? So, patients are autonomous individuals. We want to afford them an excellent level of care. We do what we can in our job, but actually part of autonomy means you have a right to act however you see fit, and that might mean that they do things that you don't necessarily expect them or want them to do, and we should just see that as it's nothing to do with me, nothing to do with my practice, I did what I can. And I think if you have that approach, gentle, where if somebody does something that you weren't expecting and you just allow it, you weather it, I think you'll be much better off. And then this is really, really important. And again, it goes against the grain sometimes, where I think there's a culture, like with a shop, you know how people say the customer is always right, or with healthcare, the patient always comes first. I would agree with that to an extent, but I think if healthcare professionals and the admin support team aren't actually looking after themselves, we're not in a really good position to afford other people care. And it can start with really simple things. So who has delayed a toilet break because they were too busy at work? Would you recommend to a patient that they do that? Would you say you should hold your pee because work is more important? You wouldn't, would you? So why do we do that? Who has eaten lunch at their desk or missed their lunch break because they were too busy? Yeah. Would you recommend that to a patient? Why are we not taking basic advice that we would give to other people when we know that that's the best thing to do? So this is a really good one. Who has deferred seeing a doctor for weeks or months about something because they don't want to take the time off work? Exactly. We're all guilty of this, and I think it contributes towards us actually being a little bit less productive instead of more productive. So, and I also don't think that there's guilt in doing that. Now, things are changing, and if we all also move forward from this point where we all have the same sheet, where no one shames or judges somebody because they took half a day off to go to a hospital appointment, and then we're all allowed to do it. All right? So that's what I think. And this lady in the corner is Mother Teresa. No one needs well, she was lovely, but you know what I mean. In healthcare, we don't need to be a Mother Teresa. Aim for good work-life balance. And again, I remember it was my interview at Birmingham University for medical school, and they said, what do you like to do outside of medicine? What do you like to do outside of your studies to relax? And I remember thinking, what a useless question. Ask me about all the things I've done. I've just done Duke of Edinburgh. Ask me about that. And then when I was doing my GP training, we had one lecture about work-life balance. We had another lecture about I was like, where are these people coming from? And then I became a GP and I realized why everyone was asking me those things. So I think it's a shame that I would have spent more time investing in that if I'd have known the return I would have got on it. So family time, alone time, physical activity, and for some people it's really only being physically extricated from their office out of the country and on a beach somewhere that means that they're able to switch off from work. Who's a bit like that? Yeah, so my advice to you is go on holiday more often. Okay, find a financial way of doing that. So that's one of my other tips. Does anyone know what this picture represents? Yes, it is self-flagellation. There's obviously a Catholic or a Shia in the house. So yeah, learn from mistakes and move on. And again, as particularly doctors, because they don't like to get things wrong, if they make a mistake, which everyone does, they take it really hard. So I won't go into all of these examples because we're a bit time pressed and I didn't realize this was going to be recorded. But once I was a junior doctor and I sent a patient home with bilateral humeral head fractures. Okay, they'd broken both of their arms. And obviously then it came to light a few days later. The consultant called me in and was actually really good about it. I went through what I'd done, we looked through the notes, and actually in that context, it was reasonable to send that patient home. They had a full range of movement, they had no bruising, I had discussed it with a senior, but I think for about 4 weeks after that, I wondered whether medicine was the right career for me or not, and whether I should continue. And I think that's because we're hardwired to have this thing that you made a mistake, you're not good enough, as opposed to you made a mistake, let's learn from this, let's do what's best for the patient, and does that make sense? So I would really try to do that daily with yourselves, with your colleagues, and especially with junior colleagues that are still in training. I hope this examination will explain why my knees are hurting, okay? Then, don't be afraid to ask for help, all right? And again, that goes for everyone. I think because, again, this expectation of being omnipotent, always knowing the answer, sometimes there's a reservation to ask, but there's so many avenues now where it can be done in a correct way that we would all benefit individually from doing that. So colleagues, specialists, doctor groups, ringing the on-call. And I think sometimes as well when a doctor is, or a practice manager alone in their office and they're confronted with a problem, it is difficult sometimes to see how easy it would be to remedy that problem if they open the door of the office and exteriorize the problem. So I think if you have a clinic with a culture where people are encouraged to share decision-making, ask when unsure, and that's seen a normal part of day-to-day practice, I think the stress levels and the mistake levels would go down. And then this is slightly topical, so I put a picture of a scandal. One of the other things is I think people who work in healthcare are afraid to talk about their day. So it's fairly normal for people who work in a shop or in an office to come home and offload and exteriorize everything that happened. Because there's patient-doctor confidentiality, because it's sensitive, I think most people don't go home and discuss it with their family. That would be a fair comment. But then equally, sometimes they're a bit reluctant to actually talk to other colleagues about things that have occurred because it might be overheard, it might be taken out of context, it's seen as, but it does mean then or it's seen as bickering or gossiping about a patient. But I think there's really something very therapeutic sometimes about actually discussing things. It's a high emotion job, and sometimes we see quite harrowing stuff. And I think there needs to be some, there are things like Balint groups, where you sit down in a circle and you talk in the church with other colleagues about what's happened. And practically, I'm not sure on a day-to-day basis how many people are going to be able to do that. So I think we need to be a little bit more flexible in modern times to accept that people need to talk about their day at work in a way that doesn't compromise confidentiality and isn't seen as negative. So I'd like to share one actual specific tangible example with you now. My GP surgery is very close to Grenfell Tower. And one day after work, I did a home visit on a young child who had lost every member of its immediate family and was now being raised by extended relatives. And I went home that day, and I would challenge most people to be able to leave that experience at the office and then just eat supper and be normal. But the difficulty I had was, if I even discussed it like I did with you in quite general terms, had I breached confidentiality because you could technically recognize, because that was quite a specific story. So can I just show a raise of hands of who would have talked to their partner or their loved one about what they were feeling? And who wouldn't? Okay, so it's about 90% would, 10%. So I actually did, because I thought if I wanted to be able to function for my patients the next day, be at my best, look after and put my own needs first, I needed to talk about it. So I was able to do that without discussing names but I think this is something that we're going to have to address a bit further as we try to move towards optimizing provider health. Really, really good tip. And my GP trainer, when I was a registrar, taught me this. He said, never make a decision that causes you to lose sleep. So if you're umming and ahhing, do I admit this patient, do I not admit this patient? Do I do this today or do I do this tomorrow? If you're going to go home and think about it, you've already answered your question. You take the route that's going to mean you don't lose sleep about it when you go home. This is just another, so this is a real actual X-ray. It's just to keep, I know it's post biscuit time. So you're allowed to say no, and there's lots of ways of saying no without even using the word no. I can see what you're saying is really important to you. I'd really like to look into this. Shall we set aside a specific time to go over this? You've just said, no, I can't talk about it right now, haven't you? But in a way that's empowering. But again, I think sometimes there's guilt associated with saying no. It's okay to say no, and we need to remember that. Treasure the good moments. This is a really good, so it is nice, isn't it, when a little kid draws you a picture and you're like, oh my God, that's so lovely, or you get a thank you card. So actually put them in an album or in a box and leave it accessible. And when you're having a really horrible day or you get a complaint, you just pull it out and you start looking through it. Actually physically do that as a take-home exercise, all right? And when it says keep gifts, there are guidelines about this. So if it's like £1,000 or a gold watch, you can't. But if it's like flowers or biscuit, yeah, do it and enjoy it. Again, I don't have time for these, but this forms a big part of my show. Find humor in your work. So things that sometimes are stressful or cause anxiety, you just find a nice way to make it laugh. So every child, when I'm examining them, if they're between 4 and 8, I ask if they smoke or not. And they all laugh, and their parents laugh, and just that small gesture. I won't tell you about the pap smear, actually. This is what it looks like when radiologists take a selfie. And then this is probably my most important slide, and that's what to do when things go wrong. So if you have a doctor where you think, I think they're substance abusing, or I think they're depressed, or something is changing and you don't know what to do, so I would encourage them to get help. And there's lots of official routes or suggested, but when they looked retrospectively at the doctor suicides, the most common denominator was that people hadn't sought help or they had left seeking help very late. And the point is, encourage them to speak to anybody professional who they feel comfortable talking with, whether that's their GP or the medical defense union or it almost becomes academic who they're speaking to as long as they're in contact with some service. And I would say it would be the same thing for you guys. Also, you need to gently reassure them. So you know how every patient with a headache thinks they have what? Brain tumor, isn't it? It's fixed. Every lady who has spotting thinks she has a gynae cancer. So every doctor that is struggling with low mood or anxiety, what is their immediate thought? They're going to be struck off. So I think if you already know, you can say the likelihood of you being struck off is very minimal. Anything that's going to come secondary to this is actually for your well-being and for the well-being of your patients. There's lots of things that could happen. You could work full-time and have care on the side. You could work part-time. You could have a phased return. You could just need a holiday. You could just need and I think, again, like that concept, when people have a closed office door and sharing the problem would make it easier, I think the problem gets bigger and it's allowed to leave. So I'm going to now, is that okay? That was the 12 points, but I had to rush through them. So I really hope there was it came from a good place, and I hope that there's some things that you can use in that. All right?